My name is Star Wright, and in this video today I'll be going over pregnancy education. What I'm going to do as I enter my patient's room is introduce myself to the patient. I would then go ahead and perform hand hygiene. From there, I would be sure to identify my patient using two forms of identifiers such as name and date of birth. I would explain to her that we're just going over some pregnancy education. The first thing that we will be discussing is foods. I would explain to my patient the foods that she should be trying to avoid would be any food that is undercooked, especially meats. I would advise her to stay away from unwashed produce, foods that are high in mercury, such as fish. I would also avoid her to stay away from large amounts of caffeine, as they can cause low birth rate, and also to avoid alcohol because that causes toxicity into their nervous system. From there, I would be going over over-the-counter medications. I would advise her that acetaminophen is an okay form of mild pain relief medication that she could use. She can use Colace for constipation and Tums for heartburn. I would advise her to stay away from medications such as Pepto-Bismol, ibuprofen, and aspirin, as those can cause bleeding. Some type of environments that she should be aware of. She should definitely be aware of staying away from any type of radiation, staying out of the hot tub because that can increase body temperature to over 101 degrees. She should also be aware of any type of household cleaning products that can be toxic, or if she's out doing yard work, just keep in mind to stay away from poisonous weed cleaners. Just be aware of her environment in that way. I would advise the mother to stay away from tobacco and alcohol, as they can cause impairment to cognition. They can also cause bleeding, and smoking causes respiratory issues. In babies, the babies can be more prone to colic, SIDS, and even cleft lip. As far as traveling, I would advise her that she should not be traveling after 36 weeks. That if she is sitting down for long periods of time, either plane or car, that can put her at higher risk for deep vein thrombosis, the causing of blood clots. So to prevent that, she should get up and stretch, walk around if she can. I would advise her to wear compression socks. In the event that she does develop this, she should go to get treatment for it, and would be seen to probably get an injection of heparin, but she should do that immediately if she's experiencing any type of pain in the legs or any other symptoms that is an indicator of deep vein thrombosis. From there, I would go over dentist work with her. I would advise her that it's okay to keep up with her normal dental care routine, that x-rays in dentistry, the radiation is pretty low, so she should be safe as far as that go. During pregnancy, she is higher at risk for gingivitis, so just keeping up with oral care, daily oral hygiene is definitely recommended. I would then ask her if she had any further questions for me regarding her education. And just allow her to know that she can call at any time. From there, I would perform hand hygiene and exit the room. That concludes my video.